Hi guys, I'd just like to talk about some of the consequences of muscle dysmorphia and muscularity related body image disorders in guys. Now this is particularly important for male athletes who can often get caught up in the no pain no gain ethos and come to sacrifice more and more important parts of their life and focus more and more on their bodies, which ultimately reduces enjoyment in life, and the parameters in which they live their life become smaller and smaller and eventually come to almost exclusively focus on their body at the exclusion of other parts of their life. One of the major consequences of muscle dysmorphia is quite simply the amount of shame and anxiety experienced by those afflicted. This condition is very correlated with intense anxiety, which can, as I say, can often result in guys becoming isolated and can even lead to full-blown clinical depression in some cases. And if left untreated, can start to spiral more and more, and life can become more and more less enjoyable, if you will. Some of the physical consequences of muscle dysmorphia are quite striking as well. And as with any male eating disorder which has a dietary component, there are physiological changes. And we often see changes in the electrolytes in the blood, which can make everyday functioning more and more difficult, and in some cases can result in osteoporosis and brittle bones, or even can result in cardiac complications and irregularities, which would of course make any sporting career very difficult. What we often see in male eating disorders which are geared around gaining weight and gaining muscle mass, we often see their diet very centred around protein intake, which in itself has some physiological consequences, and particularly on the renal system. And quite simply, the kidneys can't process massive amounts of protein, and so that also has damaging effects physiologically on those afflicted with muscle dysmorphia. Perhaps one of the most striking consequences of muscle dysmorphia, however, is the association with anabolic steroid abuse or any performance or appearance enhancing substance abuse, including things like human growth hormone and diuretics as well. These drugs and these substances have a massive array of physical and psychological side effects and consequences, which can include steroid-induced psychosis, the infamous roid rage, premature heart attacks, and the list goes on, and people have reported seeing personality changes even in those abusing anabolic steroids on the context of this intense irritability and aggression. Overall and in general, the consequences of muscle dysmorphia are very sort of widespread and far-reaching, and we generally see one's quality of life declining quite a lot, and eventually life can become very unenjoyable, and there's a large amount of depression, and at the end living a normal life can become very hard. As time goes by and these guys come to focus more simply on their physical appearance, their training and their diet, it becomes harder and harder to live a normal life. Just to finish up, guys, I'd really strongly recommend that if you do recognise any of these features in anybody you're working with, a teammate or even a family member, I'd really strongly recommend that you seek professional advice. There are no positive consequences of muscle dysmorphia or body image concerns, only negative ones. And if left untreated, this disorder can sort of spiral and snowball. And it's really important for those afflicted that they get help.